we are going to talk about the vaginal discharge. Is your vaginal discharge normal or is it abnormal? So what are the features of a normal vaginal discharge? So normal vaginal discharge occurs due to the effect of estrogen normally. It's a female hormone which is secreted normally. Right? So normal vaginal discharge is common in females after attaining puberty and before menopause, during the period of between puberty to menopause. So normal vaginal discharge contains epithelial cells from the vagina and the epithelial cells from the cervix. Those are skin-like cells. Right? Then also vagina has some normal bacteria. So there may be some normal bacteria in the normal vaginal discharge. And also there are mucus secretions because that is secreted from the mucus glands in the vagina and cervix. So there will be mucus secretions. So those are the parts of normal vaginal discharge. So normal vaginal discharge occurs between puberty and menopause, and they normally contains vaginal epithelial cells, few bacteria, and also mucoid secretions from the vagina and cervix. So what are the qualities of a normal vaginal discharge? The quantity. Quantity is usually less than 1 teaspoonful per day, less than 5 ml. Right? Does it have odor? No. There is no odor, maybe a mild odor. Other than that, there is no bad odor. Right? And also it is clear to the appearance and is sticky because of the mucoid nature. It's sticky. Right? And also the normal vaginal discharge, now I said is normally less than 5 ml, but increased normal vaginal discharge can occur in certain situations. Example, during sexual stimulation, during ovulation, when it is close to menstruation, during pregnancy, and use of the hormonal contraceptives, because hormonal contraceptives have estrogen. So there, when you take extra estrogen, there will be more vaginal discharge. So other than that, normal vaginal discharge is less than 5 ml, less than 1 teaspoonful. Is the vaginal discharge is abnormal? So what are the features of the abnormal vaginal discharge? Right? So there is vaginal irritation, or there is itching and pain in and around the vagina. Right? That is not a normal feature. So the discharge is, I said this normally is clear, but when it's abnormal, it can be yellowish, it can be greenish, and it's thicker than normal. Right? And then there's a bad odor. Right? And there may be associated low abdominal or pelvic pain, low abdominal pain. And also they may have pain with sexual intercourse. Right? Then also there is maybe presence of fever. So if any of these features are present, it indicates abnormal vaginal discharge. So what are the causes of abnormal vaginal discharge? So vaginal candidiasis, which is caused by yeast called Candida albicans, gonorrhea, which is caused by a bacterium called Neisseria gonorrhoeae, Chlamydia trachomatis infection, which is caused by another bacterium called Chlamydia trachomatis, bacterial vaginosis, that is caused by a group of bacteria, anaerobic bacteria, mainly anaerobes. Then Trichomonas vaginalis, producing trichomonal vaginitis, which is caused by a protozoan, Trichomonas vaginalis. Right? So those are the common causes of vaginal discharge. We'll talk each of them separately in short details. Vaginal candidiasis. Remember, vaginal candidiasis is not a sexually transmitted disease. What are the risk factors for vaginal candidiasis? Use of antibiotics. You take a normal antibiotic for maybe for sore throat, cough, or maybe for urinary tract infection. You take antibiotic, and antibiotic kill the normal bacteria and the yeast that causes vaginal candidiasis, right? Candida albicans overgrowth, right? That produce vaginal candidiasis, right? So that is one reason, use of antibiotics, especially broad spectrum, very powerful antibiotics. Then also obesity is a risk factor for vaginal candidiasis. Use of oral contraceptives, because anything that contains extra estrogen can cause candidiasis. So because oral contraceptives contain estrogen. Pregnancy, because of more estrogen, can cause candidiasis, vaginal candidiasis. Diabetes mellitus, because diabetes mellitus is more glucose in blood, so more glucose in secretions. So the Candida albicans, the yeast will grow nicely and produce vaginal candidiasis. Immunosuppression, when your immune system is weak, right, candida will overgrow. So it's a immunosuppression is another cause of vaginal discharge. So what are the features of vaginal candidiasis? Thick curd-like discharge, milky discharge, right, milky discharge, and also the patient complains of itchiness and feeling of burning in and around the vagina. So that is the features of vaginal candidiasis. Then gonorrhea is caused by Neisseria gonorrhoeae, right? So it's a sexual transmitted disease. So if somebody has gonorrhea, it indicates unprotected sexual intercourse. It's a risk factor usually associated with, the unprotected sexual intercourse, right? So the discharge is yellowish, vaginal discharge, and there may be bleeding in between menstruations. We call it intermenstrual bleeding. And also there can be burning and painful urination, because the Neisseria gonorrhoeae, the bacterium, also can enter the lower urinary tract and causing urethritis. That's why they can develop burning and painful urination. So these are the features of gonorrhea, right? Then if there is chlamydia trachomatis infection, that also can produce vaginal discharge. Risk factor is unprotected sexual intercourse, right? So the discharge is yellowish mucoid, little watery like discharge, but it can be yellowish, right? Mucoid like discharge. And also the organism can enter the lower urinary tract and produce burning and painful urination. So that is chlamydia trachomatis infection. Bacterial vaginosis, then it is also associated with unprotected sexual intercourse, right? So there is the patient usually complains of a fishy odor in the vaginal discharge, fishy odor, right? Rotten fish odor in the vaginal discharge. And the vaginal discharge is thick and gray vaginal discharge, right? So that is about bacterial vaginosis. It's caused by a group of anaerobic bacteria that produce unpleasant gases. Then trichomonal vaginitis. Unprotected sexual intercourse is a risk factor because it's a sexual transmitted disease, and patients present with malodorous, bad smelling, frothy yellowish green discharge. Malodorous, frothy yellowish green discharge, and also there can be associated burning and painful urination. So trichomonal vaginitis is caused by a protozoan called Trichomonas vaginalis. So it is also a sexually transmitted disease. So these are the common causes of vaginal discharge. So if it is an abnormal vaginal discharge, any abnormal vaginal discharge, please consult your doctor. I hope you enjoyed this lecture, and see you with another lecture. Thank you.